All right, so one of the things I'll be talking about today is the WHO checklist. So this is one of the checklists that tracks around the surgical procedures, right? So it is aimed at reducing the never events and complications, and in the end, surgical mortality itself. You can say about 40% of the complications, around 50% of the surgical mortality. So now, so it has three. If you, I mean, it's based on the checklist, but I'll try to get an interpretation which you can easily follow. So now it has a, what do you say, a sign in, a timeout, and a sign out phase. So all these three, there are three different points where the checks are applied. So the first one, you're bringing in the patient into the theater, right? So you are basically asking the patient his or her details. What's your name, the identity, the numbers, the identification numbers in the hospital, the age, and you're asking all those things, right? You're seeing whether the ward preparations are complete and the surgical sites are marked. These are just basic things you're checking prior to that. And always remember, you have certain issues with the anesthesia team as well as the surgical team. So now when it comes to the anesthesia team, so you have to ask about, they generally will ask about, is there any kind of allergies, drug allergies. So those things have to be mentioned by, so you can directly ask the patient. The patient is here, he's fine. So you ask that from the patient. Or maybe you go through the records and just revise on that. So now then after that you have to ask whether there's any kind of airway risk, and whether the anesthesia machines, which is the ventilators, defibrillators, all those things, whether they are all working and function, because those things are very important. Then after that, we have the surgical concern. So surgical concern is pretty straightforward. You have to ask whether there's any kind of blood loss. It can be greater than 500 ml or something like that. You have to ask that. So that's basically your sign procedure. It's not that complicated. You just ask from the different aspects. You just go through them one by one and ask. So now let's say you are finished in, now about to make the incision. Just prior to that, you want to just do certain things. Now that's the second one. That is the timeout. Everything's patient prepped up now before the surgery itself. Now you just want to check a few things. Just mostly see that you are in board, right? So here what you're going to do is you're going to reintroduce, because people who are in the theater, they don't know each other well, and that can lead to miscommunication. And one of the things also that I forgot to mention that this checklist promotes is again communication. So communication is another one of the key things. So what you have to do is introduce yourself, reconfirm the details of the patient, and then again, what is that? You go through the concerns of the anesthesia as well as the surgical team. Right? You ask whether there is any anesthesia specific concerns, and you ask whether there's any surgical concerns, like in the sense, are there any different steps that they have to think about. Then and most importantly, which I forgot to mention, is the surgical site infection bundle. There's a SSI bundle, right? That's aimed at reducing the risk of infection. So that is basically your antibiotic prophylaxis, right? So you have to set up the proper prophylaxis for this patient based on the surgical wound classification. So that is that. And after, so that's basically it, right? So you have to reintroduce yourself, and the patient's details have to be confirmed. The anesthesia surgical, again you ask about them, their concerns, and whether there's any routine steps, non-routine steps. And after that, you had to also keep in mind of the SSI bundle and the warmers and all those things. So after this, now you're going to the what do you say, timeout. I mean you're going to the sign out. Okay, your surgery is finished, so now you're coming out. So generally, in the sense, when the surgery is finished, what you have to keep in mind is whether all the instruments have been taken out, right? The instruments, the sponge counts, all those counts have to be ensured by the nursing staff. Then whether the procedures, everything has been done, written properly, everything is in check. So those things have to be checked down, and then the surgical anesthesia team can talk about the patient's recovery from that point. Whether there's any kind of ICU booking and all those things, they can probably, those things are probably set up even prior to the surgery, because you have to have those things ready if you're, before going to the theater. So that is pretty much it, the WHO checklist. So if you do not, there's no need to memorize all of it. Just understand what is happening. So if you can understand what's happening, it's very easy to correlate what to go with.